Imagine a world where scaling your bioprocess from a 1 milliliter shake flask to a 30,000-liter tank is no longer a gamble, it's predictable to within 10%. Welcome to the February 2026 Bioprocess and Biomanufacturing Intelligence Bulletin, the monthly dispatch that just dropped the biggest reality check the industry has seen in years. This month the field finally graduates from a cool lab trick to industrial superpower, engineered yeast that laughs at the viscosity wall and finally makes GLP-1 drugs at scale, record-breaking 72.7 GeL bio-nylon precursors, AI soft sensors now running live in commercial suites with plus or minus 3 to 5% accuracy. Brand new 4000L and 5000L shared pilot plants opening in California and Hyderabad to kill the valley of death once and for all, and a fresh wave of 9-figure capital chasing everything from animal-free dairy proteins to next-gen chromatography that's 2-3 times faster than old-school depth filters. We're also calling out the real bottlenecks, why hybrid human-AI teams are beating pure robot scientists and why FDA model validation rules are still the biggest speed bump to fully autonomous manufacturing. 10 game-changing takeaways, 0 filler. If you're building, investing in, or regulating anything that ferments, this is the 22 minutes that will save you months of trial and error. Stay with me, because the biomanufacturing revolution just went from a maybe someday to the right now.
Welcome back to the Deep Dive. It is February 2026, and we're looking at a stack of reports today that really suggest the vibe in the bioprocessing world has fundamentally shifted. I'm your host, and as always, I'm joined by our lead analyst to unpack all of this.
Hey everyone. Yeah, it's great to be here, and you're right about that shift.
Right, because for the last few years, we've just been swimming in this sea of hype. Lots of biorevolution promises that looked incredible on a pitch deck, but basically fell apart the second they hit a 10,000-liter tank.
Yeah, the classic biotech paradox. You have this amazing, elegant science, but the manufacturing is just a nightmare.
Exactly. But looking at the February edition of the Bioprocess and Biomanufacturing Intelligence Bulletin, the headline is basically pragmatic maturation, which I know sounds a little boring.
It does sound a bit dry.
It does. But I actually think it's the most exciting thing we've heard in a decade. It feels like we are finally moving away from cool science experiments and into actual, reliable industrial reality.
I wouldn't call it boring at all. Honestly, I'd call it profitable. The real theme we're seeing this month is convergence. You've got the hardcore strain engineering, the physical infrastructure, and the AI models, and they're all finally locking together to solve actual bottlenecks.
Right. We aren't just talking about designing new molecules anymore.
Exactly. We're talking about the unsexy stuff. Viscosity, depth filtration, regulatory frameworks, the stuff that actually determines if a drug ever makes it to a patient, or if a material can actually reach the market at a viable price point.
Yeah, and we have some massive examples of that convergence to cover today. So our mission for this deep dive is to extract the top takeaways from all these sources. We're going to talk about a scale-up jump that honestly shouldn't be possible. A 30,000-fold increase in volume that worked.
First try, too.
Yeah, first try. We've also got a new bacterial strain that might finally make bio-nylon cheaper than oil. And we have a solution to a literal sticky problem that has been completely choking the supply of the world's most popular weight loss drugs.
It is a dense month. And the key thread here is that we are seeing real bridges being built over the valley of death.
The phase where startups just bleed cash trying to build a pilot plant.
Right. And the data this month suggests we might finally have a reliable map to get across that chasm.
Okay, so let's map this out for you listening at home. We'll start with the biology breakthroughs, the actual molecular stuff. Then we'll move into the manufacturing evolution, the sensors, the scale-up, and that whole robot scientist myth. And we'll finish up with the business landscape, looking at where the concrete is actually being poured.
Sounds perfect. Let's dive in.
Let's start with the molecule that is arguably defining this entire decade. GLP-1 agonists. Semaglutide, the massive weight loss drugs. Right now, demand is basically infinite, but the supply is incredibly constrained. Why is that?
Well, I think everyone outside the industry assumes the bottleneck is just, building more factories. But there's a serious physics problem happening inside the tank. It's known as the viscosity wall.
Break that down for us.
So we usually use yeast to brew these peptides. But GLP-1 peptides are really tricky. When you try to produce them at the specific pH levels required for the fermentation, the broth basically stops behaving like a liquid. It turns into a pseudoplastic fluid.
Pseudoplastic, that's a fun term.
Yeah, think of it like ketchup. Or just a really, really thick sludge When the broth gets that thick, you simply can't mix it. And if you can't mix it, you can't distribute oxygen.
And the yeast suffocates.
Exactly. If they can't breathe, they stop making the drug. So you end up with a massive bioreactor full of expensive sludge and hardly any active product.
So the physics of the fluid is actively fighting the biology of the cell.
Exactly. But this month, researchers published this brilliant engineering solution that tackles both sides of that equation. It's a two-pronged attack. First, they engineered the yeast strain to actually operate at a higher pH.
Oh, because if you keep the pH higher, you avoid the chemical aggregation that causes the sludge in the first place.
Right. But usually, yeast really hates high pH. It stresses them out.
Yeah, they don't thrive.
Which is why the second step was pure genetic surgery. They identified and completely deleted the AMN1 gene.
AMN1, what does that do?
It's essentially a clumping factor. It's a gene that encourages the yeast cells to stick together, which is great for yeast trying to survive in nature, but it's terrible for a commercial bioreactor.
So by deleting that, they stop the sticking.
Right. By knocking out AMN1 and adapting the strain to that higher pH, they managed to keep the broth behavior near Newtonian.
Meaning it flows like water again.
Yes. It completely restores the oxygen mass transfer. The yeast can breathe, the impeller can actually mix the tank, and suddenly you've unlocked this massive supply constraint. This isn't just a neat academic trick. This is how you drop the cost of goods sold and actually get these GLP-1 drugs to millions more people.
That's a perfect example of knowing what to delete, not just what to insert into the genome.
Absolutely.
So let's stay on the topic of hardcore strain engineering, but let's swap out high-value pharma for high-volume commodity chemicals. Let's talk about nylon.
Bio-nylon, this holy grail of the circular economy.
Right. Specifically, a precursor chemical called putrescine, which, aside from having a name that literally implies it smells like rotting meat,
Oh, it really does live up to the name. It is awful.
it is essential for making nylon 4,6. And the big headline here is that researchers hit a record titer of 72.7 grams per liter using E. coli. Now, that's a huge number, but I feel like we see high titers in academic papers all the time. Why does this one actually matter?
You always have to look at the fine print with those papers. Usually, to get a number that high, you have to feed the bacteria incredibly expensive treats. Yeast extract highly specialized amino acids. And sure, that works in a lab.
But it totally kills your unit economics.
Exactly. If you're competing with petrochemical nylon, which is dirt cheap, you cannot be feeding your bacteria caviar.
You need them to eat plain toast.
Plain toast, just basic glucose. And that's exactly what this team achieved. They hit that 72.7 grams per liter using only glucose and minimal salts. Zero expensive supplements.
How do they manage that?
It was a masterclass in systems metabolic engineering. They didn't just tweak one or two genes, they rewired the entire metabolic dashboard. They fine-tuned the expression of phosphoryl pyruvate carboxylase.
Say that 3 times fast.
No thanks. But crucially, they knocked out the competing biological pathways.
So they stripped away all the distractions.
Right. They essentially forced the cell to obsess over making nothing but putrescine. It's like putting blinders on a racehorse. And by doing that, they brought bio-based nylon to a technology readiness level of about 5 or 6.
Which means it's ready for pilot scale. It's moving out of theory and into genuine economic viability.
Exactly.
And speaking of moving the pilot scale, that is the perfect segue to our second bucket today, predicting the future. Scale-up is historically where biotech companies just go to die, the whole black box problem.
It is the single biggest failure point in our industry. You get a strain working beautifully in a 1 milliliter well plate. It looks like a massive winner. But when you put that exact same strain into a 1,000-liter tank, the physics completely change. You've got intense hydrostatic pressure, shear stress from the mixing blades, massive oxygen and CO2 gradients.
The biology just gets confused and shuts down.
It panics.
So the standard industry practice has always been baby steps. You go from 1 milliliter to 1 liter, then 10 liters, then 100. It takes years.
Years and tens of millions of dollars. But this month, we saw a joint framework from BTech and Biomade that completely challenges that paradigm. They executed a 30,000-fold volume jump from 1 milliliter directly to 30 liters.
That sounds almost reckless.
It would be without the new AI and statistical models. But their predictive accuracy for both the biomass and the final product titer was within 10%.
Wow. Within 10%. How did they bridge that physical gap without running all those intermediate steps?
They built a statistical framework that connects the microbioreactor data straight to the pilot scale by mathematically accounting for those physical realities we just mentioned.
The mixing dead zones, the shear stress.
Right. They essentially modeled all the bad parts of the big tank and simulated those exact stresses in the data analysis of the small tank.
Oh, so they knew the big tank would be an imperfect environment, and they predicted exactly how imperfect it would be and how the cell would react.
Precisely. And because this is Biomad, which is a public-private manufacturing institute, this knowledge isn't just locked behind some corporate firewall at Pfizer or Merck. It's being shared across the industry. This could slash development timelines by 12 to 18 months for early-stage startups.
That is time and capital they desperately need. Now, while we are on the topic of computers and prediction, we really need to address the robot scientist. Because for the last 3 years, the venture capital narrative has been, just get an AI, hook it up to a robotic arm, and let it run the entire lab autonomously.
The cloud lab dream. Yeah, we are seeing a definitive shift away from that consensus this month.
So the robot overlords aren't taking over biomanufacturing.
Not entirely, no. There was a very significant review paper by Helix and colleagues that really put a pin in that balloon. The industry is moving toward what they call a hybrid model.
Why is that? If the AI is so incredibly smart at screening strains, why can't it just run the whole plant?
Because biology interacts with physics in ways that are chaotic and unpredictable. AI is fantastic at high autonomy strain screening. It can evaluate gene edits 50 times faster than a human. It's great at answering the what gene should I edit?
But it fails at the how.
It fails at the intuition required for physical scale-up.
Right.
When you are standing in front of a 20,000-liter bioreactor and the foam level starts rising unexpectedly, or the pressure is spiking in a weird way, you need human intuition. You need a deep, practical understanding of fluid dynamics. The robot simply can't feel the process.
So the future isn't a fully autonomous lab, it's more of a centaur.
Exactly. Half human, half machine. Let the AI do all the massive data crunching and the initial strain screening, but you keep the human engineer firmly in the loop to manage the physical realities of the scale-up. We aren't replacing the scientists, we are just upgrading them.
Which honestly feels a lot more pragmatic. Let's move on to the factory floor itself, our third segment. Because the tools inside the factory are getting dramatically smarter, even if they aren't fully autonomous yet. We're finally seeing AI soft sensors hit true commercial deployment.
Yes, and this is a term that really confuses people. A soft sensor is not a physical piece of squishy hardware.
It's not a foam pad on the tank.
No, it's software. It's taking the data we can already easily measure continuously, like pH, dissolved oxygen, off-gas emissions, and using an AI model to instantly infer something we can't easily measure, like the exact real-time concentration of a specific metabolite or the drug titer itself.
And they're pairing this with process analytical technology like Raman spectroscopy.
Yes, and the big news this month is that commercial monoclonal antibody suites, the massive factories making the most expensive drugs, are achieving plus or minus 3 to 5% accuracy with these virtual soft sensors.
That's incredibly precise.
Yeah.
What does that actually unlock for the plant operator?
Two massive things. First is automated feed control. The system now knows exactly when the cells are getting hungry and feeds them the exact right amount of nutrients at the perfect time. No more guessing. But the real holy grail here is RTRT, real-time release testing.
Break that down for the listener. Why is RTRT the holy grail?
Think about how a plant works right now. You finish a massive batch, you hold it in a tank, you take a physical sample, walk it down the hall to a lab, run it on an HPLC machine, and then you wait 72 hours just to see if the batch is pure and meets spec.
Meanwhile, your multi-million-dollar tank is just sitting there doing nothing.
Right. With real-time release testing, your AI sensors are so accurate that you know the batch is good the literal second the fermentation finishes. You can pump it straight into purification. You completely skip the 3-day wait. That efficiency gain is worth tens of millions of dollars over a year.
But that creates a completely new problem, doesn't it? If we are making way more product upstream, thanks to these soft sensors and better yeast strains, we just slam right into a wall downstream. The pipes literally get clogged.
Ah, the downstream bottleneck. It's a classic bioprocessing problem. As the upstream titers go up, meaning we're making more soup per liter, the soup gets substantially thicker, and that completely destroys traditional filtration systems.
So the old method of depth filtration, just pushing it through a distinct physical filter, is dying.
It's actively being swapped out. The major trend we are tracking this month is a heavy pivot toward chromatographic clarification.
That sounds inherently more expensive.
Upfront, maybe, but it's vastly more efficient. The new data shows 20 to 30% higher yields and processing times that are 2 to 3 times faster than traditional depth filtration. If you are running a modern high-titer facility, you almost have no choice but to make this switch. Otherwise, your downstream purification team is just drowning in harvests they can't process fast enough.
Right. It doesn't matter how much you make if you can't get it out of the broth.
Exactly.
So we've covered the science and the factory floor. Let's shift to the business landscape for segment 4. Because none of this amazing tech actually matters if you can't pay for the steel and the concrete.
And this brings us right back to that valley of death we talked about.
We mentioned earlier that bridges are finally being built. Where are these bridges?
In shared infrastructure. For a long time, if you wanted to scale up your cool new microbe, you had to literally build your own pilot plant. That costs, say, $10 million. But most early startups only have about $2 million in seed funding. So they die.
Game over before they even really start.
But look at the facilities coming online this month. BioMade just opened a 4,000-liter facility in Hayward, California. And over in Hyderabad, Proferco and Glatt opened a new 1,500-liter scale-up center.
And the key distinction is that these are for rent.
Exactly. It's scale-up as a service. It completely democratizes the process. You don't need $10 million anymore. You just need enough runway to rent the tank time to prove your technology actually works at scale. This is how you keep a diverse ecosystem of startups alive.
Speaking of that facility in India, that Hyderabad plant signals a much larger macroeconomic shift, doesn't it? I think we usually think of India as the generic pharmacy of the world, just churning out aspirin and small molecule drugs.
That narrative is getting very outdated very quickly. India is rapidly pivoting to the high end. Look at Airgen CDMO. They just operationalized a $30 million facility with 5,000 liters of single-use GMP capacity.
You don't build 5,000 liters of single-use GMP just to make ibuprofen.
No, you absolutely do not. That is built specifically for complex biologics outsourcing. And it's backed by a $100 million private equity injection. They are intentionally moving up the value chain, offering Western biotechs a high-end manufacturing hub that isn't dependent on China and isn't as expensive as the U.S. It's a major geopolitical shift in the global supply chain.
It's a smart play. If you can deliver high-quality biologics at Indian cost structures, you're going to win a massive amount of contract business.
Without a doubt.
Let's follow the money over to France for a second. The alternative protein market frankly took a beating in 2024 and 2025. It seemed like the bubble burst. But looking at the intel this month, it looks like capital is actually returning to precision fermentation.
It is returning, but it's smart money now. The pure hype cycle is over. You can't just walk into a VC office, pitch it's animal-free, and get a massive check anymore.
So what actually gets funded in 2026?
High-performance functionality. Look at a French company called Verily. They just secured a 32 million euro Series A round to commercialize their product in the U.S. They are making animal-free beta-lactoglobulin.
Which is a highly specific whey protein.
Right. But the key is they aren't trying to make a generic glass of milk. They are making a high-performance ingredient that provides specific structure, gelling, and foaming properties in food manufacturing.
So the lesson for the industry is, don't try to replace the whole cow. Just replace the one very specific part of the cow that does the heavy lifting for food scientists.
Exactly. Investors are betting heavily on B2B ingredients that can command a premium price because they actually perform a valuable functional role in the food matrix.
Okay, we have covered a ton of optimism today, but we have to end on a reality check, the final bottleneck. We've talked about all this amazing AI, the soft sensors, the predictive scale-up. So why isn't the AI just running the whole show already?
It all comes down to the FDA and the immense challenge of regulatory validation.
The FDA does have a draft credibility framework for machine learning now, but reading through it, it seems pretty incomplete.
The framework demands greater than 95% accuracy for these models. That's very hard, but as we saw with the soft sensors, it is achievable. The real systemic problem is something called model lifecycle management.
Which means what in practice?
Think about it. Imagine you have an AI running your GMP factory. The entire point of artificial intelligence is that it learns. It evolves. It adapts its algorithms based on new data it observes.
Right, it gets smarter over time. That's the selling point.
But in a GMP environment, good manufacturing practice, the golden rule above everything else is consistency. If your model drifts or changes its decision-making process because it learned something new on a Tuesday, is it still the exact same validated process you got approved by the FDA on Monday?
Oh, I see. And if the process fundamentally changed, how can you guarantee the drug is still perfectly safe?
Exactly. How do you validate an algorithm that is designed to constantly change? Do you have to halt production and completely revalidate the system every single time the model updates its weights? Because that would completely destroy your operational efficiency.
So until the regulators actually figure out a framework to handle learning machines.
The AI will remain an advisor on the factory floor, not the commander. This lack of clear guidance on handling model drift and retraining in a GMP setting is the true bottleneck to the fully autonomous factory. It's not a limitation of the technology anymore, it's a limitation of the rule book.
That is a fascinating place to leave it. We have the biology working, breaking the viscosity wall and hitting record titers. We have the tools, the sensors, and the chromatography. We are building the infrastructure, the shared pilot plants, and the huge Indian CDMOs. But the human element, specifically the regulatory human, is still the ultimate gatekeeper.
As it probably should be, honestly, when patient safety is involved.
Very true. But I want to leave you, the listener, with one final, slightly provocative thought, based on our earlier discussion about the hybrid centaur scientist.
Okay, let's hear it.
If we accept this pragmatic future, where AI handles all the high-throughput screening, basically finding the what, and humans only focus on the physical scale-up, the how, are we training a whole generation of scientists who know exactly how to build and run a factory, but have absolutely no idea what to put in it?
That is the intuition gap.
Exactly. If the computer just tells you, hey, strain B is the best, and you just blindly accept it, do you truly understand the fundamental biology underlying that decision? What happens when the algorithm gets it wrong in a way that isn't immediately obvious to a human? Are we just outsourcing our scientific curiosity to a black box?
We very well might be. And making sure we don't lose that fundamental why behind the biology is going to be the central challenge for every university and biotech CEO for the next 10 years.
Well, on that slightly existential note, that concludes our deep dive into the February 2026 intelligence. The industry is definitely maturing, and the tools are finally working at scale. But keep your hands on the wheel.
And always keep checking the data.
Thanks for joining us. Keep building, and we'll see you next time.
That's this month's Bioprocess Intelligence. If you're turning biology into manufacturing at scale, these are the signals to watch. I'm Prasad Ernala. See you next month on Biomanufacturing and Fermentation Technology.